Yeah. So, ladies and gentlemen, welcome to our fourth Zoom platform meeting live in Facebook to mark June Lipoedema Awareness Month. This event is organized jointly by our Global Lipoedema Awareness Surgeries Doctor Group and the Italian Lipoedema Association, tonight represented by Alessandra Licini, member of the board of the association, with whom I will co-chair the event with our host, Dr. Bruno. Thank you, Dr. Bruno. I know how busy your schedule was, and it took us some time to organize this event tonight, but you didn't let us down, and we will not let you down either. So thank you for making time, and I'm sure you will spend a couple of hours with us tonight. Since we stole you for the evening, you stay with us. Okay, Valeria Giordano, chair of the association, is recovering from a huge operation she had with Dr. Bruno. So she would love to say hello to all the Lipi sisters here tonight later on. The Global Lipoedema Group has a strong membership of 9,150 members from around 100 countries and is dedicated only to surgeries and doctors. It took us 4 years of hard work to search and discover where these doctors are, because when I started, I had only 5 doctors to choose to have my operations in 2015. Today, we are proud to announce that we have 180 doctors from around the world who treat lipoedema. As we know, there is no cure. Co-hosting the event with us tonight is Patricia Ruiz-Lopez, Natalie Spenle, and Mia Jackson, who will help with questions if we have any in Spanish, French, Italian, and English. Of course, is the language of the evening. Last but not least, I would like to extend our warm thanks on behalf of both groups to the administrators, Mia Jackson, Julia Macy, Maureen McCartney, Lisa Lehrer-Dixon, Patricia Ruiz-Lopez, Therese Rentagoco, Danai Pancho, Natalie Spenle, Annalisa Bianchi, Marina Correse, Alessia Milan, for their volunteer work and support to the lipoedema community globally. In addition, our thanks go to all the participants tonight, both here at the Zoom platform and in the Global Lipoedema group, where we have more numbers than here. Both groups have no financial benefits from our activities. We welcome Kate Foster, board member of Lipoedema UK, Sarah Souther Namore, group owner of the Lipedema Sisters USA, the largest American USA group with over 8,000 members. We do some exciting projects with Sarah, and Dalibor Svek from Lipoelastic UK. Dalibor is supporting us throughout the year with special offers for compressions, because as we all know, compressions are costly and they play an important role in the recovery of every lipoedema patient, operated patient, and conservative treatment as well. And now it is my honor to say a few words about Dr. Agostino Bruno, who is a senior consultant in plastic and reconstructive surgery with a significant expertise in the surgical treatment of lipoedema and in post-bariatric plastic surgery. He currently works for the Italian NHS as a senior consultant at the Center for Major Burns Plastic Surgery of the St. Eugenio Hospital in Rome. He's also consulting for pediatric burns at the Gemelli Hospital, General Hospital in Rome, and adjunct professor of lipofiling at the Cattolica University, 2 of the most prominent academic bodies in medical science and clinical practice in Italy. At the forefront of research on lipoedema surgery, he was due to present his work on laser tightening with the J-plasma Renuvion technique at the FEDRS 2020 conference, But like many other conferences worldwide, this one has to be canceled due to COVID-19. And I think we will be privileged tonight to have Dr. Bruno to let us see some of his work on this specific topic. At a very young age, he was awarded an honorific title by the President of Italy, and this was in 1999. I know he doesn't like people knowing these things, but for us it's very important, and it plays a role that our doctors excel in various layers of society, especially the medical one, for which I had the highest regard. And I'm sure Dr. Bruno is a well-deserved auguri. I will pass you now to Alessandra, who would like to speak about the work the Italian Association they do with Dr. Bruno. Alessandra will be brief because we have a long night. She promised me 4 minutes maximum. And then Dr. Bruno, patience with us, is part of the conferences that we take some time to do these presentations. Thank you very much for listening, and welcome again to our family.
Thank you.
Thank you, Maria. Hi, everyone. I'm Alessandra. I'm a member of the board of LIO, which is the first Italian charity that supports lipedema patients, lipedema carers, and also the professionals. And we try to provide them with information, basically, and all evidence-based tools to tackle this disease. We have a website that we are very proud to say it is the first collection in the Italian language of materials on lipedema, so videos, articles, resources on for patients and professionals. And on the website, you will find links to the Facebook page that we set up, a page which is open to all women who suspect to have lipedema, and where people can reach out to us, and we are happy then to redirect these patients, these prospective patients, to the specialists that are able to diagnose, study it, and treat lipedema in Italy, which I'm afraid are still very few. We have then 2 private groups on Facebook, one aimed to host and liaise with professionals, and one only dedicated to patients with that already have a diagnosis of lipedema. We are honored, of course, to be at the same virtual table as with Dr. Bruno, who is also a member of our scientific advisory committee. The story of LIO itself is strictly intertwined with Dr. Bruno, because he was the first medical professional to diagnose lipedema to Valeria Giordano, our founding chairperson. And after their encounter, there were many others that in one way or another led Valeria to meet other patients, and eventually, with daily conversation with Dr. Bruno and other lipedema specialists, turn that mention, that strange unknown word lipedema, into action, into something concrete, which became important to lots and lots of lipedema patients. Apart from this historical link to him, we deeply respect and admire his work, because his work as a surgeon is undebatably incredible, and also his dedication to lipedema patients. We are often in awe when we see how he has been able to transfer his skills, his surgical skills, into this relatively new niche of the medical arts, which is the surgery of lipedema. I have some pictures maybe that can testify. Let me see if I can share my screen. I mean, his natural ability to give. You can share. Sorry, yeah, I'm sharing the screen if you don't mind, if I still have time. So these are pictures from that you can find on his Instagram account, and this is a picture from a so-called mummy makeover, and his ability to let's say give back, to give a natural look to a plastic reconstruction, be it a mummy makeover or a post-bariatric surgery or a lipedema surgical intervention such as this or this or this, really, I mean, it's without any doubts. So you will see, obviously, account is Instagram accounts, and I think that at this point I will try to be very brief. Very brief, I promise, and I maintain my promise. And I can just pass the ball back to Maria and maybe start our webinar with Dr. Bruno.
Yes, now the floor is for Dr. Bruno.
Okay, thank you. Good evening, everybody. I'm Dr. Agostino Bruno. I work in Rome. First of all, I'd like to say hello to Maria, and I'd like to thank her for the invitation in this useful event that takes place in the month of the lipedema awareness. I would also like to thank all the participants of this event, and I'll try to answer all your questions. The topic of today is the use of the different tools I use in the treatment of lipedema patients. For those of you who follow me on the social media, on the social network, you can find that lipedema is treated by many tools. So I'd like to explain to you the reasons of this choose, and I'd like to say why I prefer to use one kind of tool instead of another, and how I try to integrate this kind of many machines, from the wall technique to PAL technique, the VASER lipo, and the newborn Renuvion J plasma for skin tightening. At the end of the procedure, we'll give a glimpse also at the body contouring procedures, because when we treat lipedema patients, we mainly perform massive liposuctions. So there's the problem of the hanging loose skin. And there's so this big other chapter of reconstruction to give integration of the body back. I prepared some slides I'd like to share with you. Let's see. So, okay. Can you see it? Okay. As we all know, for the surgical treatment of lipedema, as Karen Herbst quotes, the only known treatment to reduce lipedema fat at this time is excision by lymph-sparing liposuction. The surgical treatment of lipedema is really demanding and complicated, because different body areas present different problems and therefore require differentiated treatment. In our practice, we use different technology to get the best functional and aesthetic outcomes. In fact, in our treatment, we use the body jet, the water-assisted liposuction. We use the power-assisted liposuction, the micro-air PAL. We use the VASER lipo technology, and we use the J plasma. So let's go into one of this. Let's see the water-assisted liposuction. Water-assisted liposuction is a technique really kind of unique. We utilize very few infiltration in the adipose tissue. After this very few infiltration, special cannulas are inserted. These cannula are able at the same time to continue to irrigate the tissue, to detach fat cells, and aspirate at the very same time. So it's really delicate, yet also very powerful to detach the fat cells and to collect them. The wall technique proved to be really useful to preserve subcutaneous lymphatic vessels. In fact, in this study, we have found that immunohistochemical staining adipocytes were found to be mostly intact, more than 70%. This accounts for a very delicate procedure because even more than 70% of fat cells are left viable. So it's really a delicate procedure. Also, all samples were positive for CD31 antibody, which means small caliber blood vessels. But the very important thing is that there was a negative staining with the marker D240 for lymphatic vessels. What does this mean? This means that wall liposuction is very gentle, as no lymphatic endothelium cells were found in the canisters of the liposuction. So it's really delicate. This is really important because in the subcutaneous space, there are many important and delicate structures. This drawing is a cross-section of the legs. In this section, we can see the crural fascia, which is depicted in blue, which separates the subcutaneous compartment from the muscular and the vascular nervous compartment. In the subcutaneous compartment, there are many important structures that we, of course, have to preserve while performing liposuction. Posteriorly, in fact, we have the small saphenous vein and the communicating branch of lateral crural cutaneous nerve. Laterally, we have the lateral sural cutaneous nerve, and anteromedially, we have the great saphenous vein and the saphenous vein. So very, very important structures. Where do we use the water-assisted liposuction? We use water-assisted liposuction, first off, in the lower legs to treat deep lipidematous fat. So our choice is to use the water-assisted liposuction in the treatment of the deeper planes of fat in the legs, because this technique is really gentle. So it preserves all the structures above mentioned, as well as the crural fascia and, of course, the muscles below. So we use to treat deep lipidematous fat in the lower legs. But we also use it in the forearm to treat deep lipidematous fat. So our approach is to use the wall technique in the lower legs and in the forearm, only to treat the deep lipidematous fat. Why is that? Because this technique is really delicate and gentle. So it's really respectful of the very delicate lymphatic, blood vessels, nerves, etc. that are in these planes. So what are the pros of the wall technique? The pros are that it preserves deep tissue, it has a great ability to mobilize deep fat deposits thanks to the controlled infiltration jet. But there are also some negative aspects of this technique that made us see for other techniques to integrate with. The cons are that we have massive postoperative drainage. We have the risk also of surface irregularity, because when this jet of infiltration first and irrigation after is directed too superficial, too near to the skin surface, it is less controllable than in the lower planes. So it can leave some skin irregularities, some indentations, etc. Of course, we all know that the main goal of lipedema liposuction is a functional one, but we also have to have a look at the aesthetic outcomes also, because we also have to remember that the legs, the arms, the forearms are really important aesthetically speaking. So we have to try and combine the powerful of a radically evacuation of fat with also an aesthetically pleasant results And in our hands, at least, the wall liposuction turned to be too much aggressive for the treatment of superficial planes. And sometimes it left with some irregularities in the skin, etc. So this is a con that have to be considered when using the wall liposuction. And also another disadvantage of this technique is the cost, because wall technique utilizes disposable kits. So we have higher cost related with this procedure. Let's have a look at another tool that we originally use, which is the power-assisted liposuction, the so-called PAL. We use the PAL system for the treatment of superficial lipidematous fat of the lower legs and forearms, as well as for the thighs and arms. The PAL system utilizes the so-called reciprocating cannulas. That means that the cannulas has a back and forth movement of 2 centimeters and up to 4,000 reps in a minute. So it is not a thing that we can see with the human eye, because the reciprocating movement is so quick that we don't have perception of that. Where do we use the PAL system? We use in the legs to treat the superficial fat after the wall liposuction. So, for the treatment of the leg, we utilize these 2 techniques. That is the wall liposuction for the deep subcutaneous lipidematous fat, because wall is really gentle and delicate. So we don't have too much risks of hurting important structures. But we also use, to finish up and to have an aesthetic touch-up, the PAL system, which is used in 2 different ways. It is used to finish the liposuction phase, because we use the power assisted in the suction mode just to aspirate the superficial fat. But we use also the PAL system in a more particular way, in a way not connected to the aspiration, but just utilizing the back and forth movement of some specialized cannula called basket cannulas or flared cannula, which can leave a smooth skin surface without indentation or irregularities. Moreover, the PAL system is more efficient and can aspirate more fat than the wall itself, as many studies have pointed out, of course. We use so in the legs, and we use in the thighs. In the thighs, we use both in the deep layers and in the superficial layers after the VASER lipo. So we treat the fat by the means of the wall system in the legs, the lower legs and the forearms, and with the VASER lipo in the thighs and in the arms. And we evacuate the fat with the PAL system in the thighs, both for the deep and superficial layers, and we finish with the equalization of the remaining normal fat tissue with the use of the specialized cannulas called flared or basket cannulas. We use the PAL in the arms, also for deep and superficial layers after the VASER lipo. And we use in the forearms for the superficial fat after the wall. So we use wall liposuction in the lower legs and the forearms for the deep layers, and we use PAL liposuction to finish in the lower legs and in the forearms, both for suction the remaining superficial fat, but also to equalize the remaining fat tissue to even the surface of the skin, leaving it really smooth without indentations. So we have a triple use of the so-called reciprocating cannula. We use it for superficial liposuction in the legs and forearms. We use in the deep and superficial liposuction in the thighs and in the arms. And we use it for the equalization of residual fat tissue to reduce indentation and skin irregularities. Of course, we do this with very, very tiny cannulas, such as the multi-hole simple cannula, which is only 3 millimeters in diameters, and the basket or flared cannula, which is also only 3 millimeters in diameters. So really, really safe and delicate cannulas. What are the pros of the pulse system? We have a great availability of cannulas. We don't have to forget that the pulse system is the most used liposuction system in the world. So we have a very, very great amount of cannula, specialized cannula, bent cannulas, which are very useful for surfaces such as the arms, etc., which are not plain, but they are curved. So it is really useful to can handle bent cannulas. We also use basket cannula to perform the equalization of the remaining fat tissue. And another advantage is that the pulse system has no monouse, so we can also have lower cost of the procedure, which is a very important aspect to consider, because unfortunately, lipedema patients have to undergo multiple procedures. So when we have something thanks to which we can have a reduced cost, is always better, of course. And there are also some cons, which are perhaps that for the deep plants, especially in the lower legs and in the forearms, perhaps the reciprocating cannula may be too aggressive. So we don't use it to treat the deep plants, only in the legs, the lower legs, and in the forearms, because probably this movement may be too much aggressive. But this is in our hands, because we try and use the best technologies available in the world, because many surgeons perform liposuction for lipedema only with the use of PAL liposuction. But in my opinion, this system turned out to be too much aggressive for these special delicate zones. So we use only for the superficial planes in these body areas. Another great tool that we use, which is really common and popular in the liposuction patient, but probably not so very common and popular in the lipedema patient, is the use of VASER lipo. VASER lipo does not aspirate the fat. VASER lipo does not have cannulas, but have probes. These probes deliver ultrasound energy that acoustically detach the fat cells from the connective and vascular network. So, in a sense, the VASER lipo is really near to the wall liposuction, because wall liposuction detaches the fat cells from the connective tissues by the use of a jet of irrigation. VASER lipo detach also the cells by the use of an acoustic wave, which is the ultrasound. But the VASER doesn't suction fat itself. It pretreats the fat, melting it up. So it can be easier aspirate by the use of another system. We use the pulse system to suction the fat pretreated with the VASER lipo. So VASER lipo allows the fragmentation and emulsification of adipose tissue. It saves the connective and vascular network, making the following aspiration phase easier and less traumatic. Also, the recovery phase of the patient is really faster, because the fat don't have to be taken away by the system called avulsion, which is really traumatic. But the fat is taken away by what is called the liposelection. So the aspiration phase is really smooth, it's really easy, because the fat is pretreated by the ultrasonic wave, So it is a fat which is detached from the surrounding network, and it's really, really more easy to suction it. So in a sense, it's really similar to the wall liposuction. The thing that changes is the means by which fat cells are detached, because the wall utilizes a spray of irrigation. VASER Lipo utilizes third generation ultrasound of 36 kilohertz for maximum selectivity for water molecules, which the process is called resonance, acoustically detach the fat cells. So the use of VASER Lipo is really safe and can be extended to lipedemous patients. In our hands, we have found that a patient submitted to a VASER Lipo has a very, very faster recovery than a patient submitted to the wall itself and also to the PAL system, because the fat is pretreated. So it doesn't have to be detached, it is already detached. Thanks to the ultrasonic energy, the adipose tissue is reduced to small clusters of fat or even single fat cells, allowing the aspiration to be performed with smaller and so less traumatic cannulas. In many studies, compared to other types of liposuction, the VASER Lipo is proved to be less traumatic. Where do we use the VASER Lipo? We use it in the thighs for sonication, which is the scientific term that means that the ultrasonic was able to detach the fat cells from the surroundings, for sonication of the deep lipedematous tissue, and also to evoke skin tightening, because this is another great advantage of this tool. The fact that VASER Lipo promotes skin tightening. This is done because the ultrasound waves delivered subcutaneously is able to act on the connective tissue, allowing a contraction of the connective tissue. So VASER Lipo is really useful also for this thing, because it can allow a very important skin retraction. Not comparable to the one that we can obtain with the use of the Renuvion J plasma, but it is also a plus that we can give to our patients, especially lipedemous patients, where we routinely perform massive liposuction, of course. We use VASER Lipo also in the arms for the sonication of deep lipedematous tissue and also to evoke skin tightening. And also for the VASER, of course, there are pros and cons. The pros of the VASER Lipo is that it allows a less traumatic liposuction, because the fat tissue is removed not with avulsion, but with the liposelection. It promotes skin retraction when used subdermally at the beginning of the procedure. And another advantage is that it has no single use, so we also can have a lower cost of the procedure itself. The cause of the VASER Lipo is that probably it may be too aggressive for the perimalleolar region. Some surgeons utilize VASER Lipo also in the perimalleolar region, but probably ultrasound may be too much aggressive for this region, so we avoid to use it there. As you can see, there is no technique explained has only pros. Everything has pros and cons. So the great results come when we have the ability and the possibility to integrate these tools, so we can get the best out of every one of each, of course. And now let's talk about the last tool we introduced for the treatment of lipedema patients. And I'm proud to say that we are among the first that utilize the Renuvion J plasma in the treatment of lipedema. Renuvion J plasma is currently used for many surgeons for aesthetic reasons because it can evoke a very important skin retraction. But we are among the first to extend this use also in lipedematous patients. Let's have a look at how Renuvion J plasma work. Renuvion J plasma is an handpiece that utilizes a plasma of helium. This helium is delivered under the skin in a retrograde fashion. The helium is very selective for connective tissue, so there's no possibility to injury nerves, vessels, etc., because helium plasma is really selective to connect tissue. Helium plasma is able to heat subcutaneous tissue at a degree of about 80 degrees centigrade. But there are no risk of burning the skin above because the skin only increase in temperature of about 4 degrees. So there's really no risks of injuring the above skin. The use of Renuvion J plasma is really important, and its effects are both immediate, as we can have an immediate strong contraction of the subcutaneous connective tissue, but also a modeling faction because it promotes the synthesis of new collagen over a period of 6 to 8 months. So the best results has to be seen in the following months when used. J plasma combines the energy of radiofrequency with the property of helium plasma to obtain a safe and controlled heating of the subcutaneous tissue, allowing a very lasting and remarkable skin contraction. Plasma is the fourth stage of matter. It is obtained when a gas, in this case the helium, is passed through an activated electrode, obtaining a plasma, which is a gas with a very stronger energy. Plasma is also extremely selective, as I said, because as we can see in this demonstration, if we utilize the helium plasma on an egg, we are able to detach the thin layer of coagulated connective tissue of the egg without the risk of hurting the egg itself. As you can see, it remains there without any problems. Where do we use Renuvion J plasma? We use Renuvion J plasma after liposuction to promote skin tightening. This approach reduces the need of subsequent body contouring procedures, or at least if body contouring procedures are unavoidable, it reduces the need of the most aggressive and invasive ones. As body contouring procedures leave scars, it is very important to have a tool that can reduce the need of longer scars in the body. So it is really useful. We have been using Renuvion J plasma since October, and the results we are seeing are really great. We have been using, and the persons in which we used had no need to undergo subsequent body contouring procedures. So this is a very major plus with the use of this tool. Also, J plasma has pros and cons. The pros of the procedure, it induces, of course, skin retraction, essential when performing massive liposuction. It reduces the need of dermal lipectomies, and in the most severe cases of skin laxity, it reduces the need of the most aggressive and invasive ones. it has a negative aspect, which is related to the cost, because Renuvian-J plasma utilizes disposable hand pieces, and unfortunately, they are really, really expensive nowadays. So this is an advantage, a disadvantage of this. Now, I'd like to share with you some results we obtained combining all these procedures, all these tools. This is an example of liposuction, a third type lipedema, in which we perform liposuction of the thighs and the legs. No need of body contouring. We can see the pre and post-op pictures of this case. As you can see, in this case, the wall technique was integrated with the PAL liposuction to treat the superficial fat and to smooth everything out. In fact, as you can see, the surface of the skin is really even, and there are no indentations or irregularities. Another case, we can see how strong we can perform liposuction, leaving only few millimeters of residual normal subcutaneous fat and leaving a regular and even surface. This is an example of treatment of lipedema in the arms with also a brachioplasty at the same time. As you can see, the amount of fat was really, really big. These arms were very heavy. So it was, we couldn't expect the skin to retract even if we had used Renuvian-J plasma. So we decided to perform a brachioplasty at the same time. In this case, a posteromedial scar was utilized, which means that the scar is really, really conceived. So it is bearable, seeable, both in the anterior view and also in the posterior view, which is very important when treating the arms, because we all know that in summer people want to use sleeveless t-shirts, etc. So it's really important that the scars are very well conceived. And this kind of brachioplasty with the posteromedial scar in our hands proved to be really, really useful because the scar is really discreet. Another case of lower legs. Lower legs are, of course, the most difficult to treat of all the body areas because of the many important structures that are present in this subcutaneous fat. But we can see how strong we can perform liposuction, also leaving a very even surface. This is a very important case. Of course, this person underwent many procedures, as you can imagine, but the results obtained speak for themselves. And also, we have to remember that no body contouring was performed. So no thigh plasty was performed here because of the use of the skin tightening. Even if the change of volume is really significant, as you can see from the pre and post-op pictures, there was not so much sagging skin requiring a subsequent thigh plasty. And the patient, of course, was very, very happy about that. Another case of legs. Other ones. Many legs. As you can see, we have talked about lipedema, we have talked about liposuction, we have talked about how we perform liposuction, the tools that we use. But then we can ask, and then what happens after liposuction? What about the skin? Because liposuction only treats the fat, but doesn't treat the skin. Here comes in help the body contouring procedures. such as the thigh plasti. As you can see, all this sagging skin that couldn't be retracted even with the Renubi-Onge plasma because it's too much. In this case, thigh plasti was performed, which is called the apex thigh plasti. Apex stands for anterior posterior extended thigh plasti, which requires both an horizontal scar here in the groin and a vertical scar that goes down up to the knee. This is the three-quarter view. Of course, there are some scars, but they are well concealed. And secondary, we can see how dramatic the improvement is from a very sagging skin, loose skin, from a very normal situation. This is the other three-quarter view. And another case also of thigh plasti. In this case, also an apex procedure was performed. So there is both an horizontal and a vertical scar, but they are very, very discreet. And the patient accepts very well a scar when the situation is something like that, with this all loose skin. The three quarters. So there is a very important improvement, both functional, because not only the fat is an obstacle for the movement, but also the sagging skin create a negative situation for the movement of the limbs. This is the other three quarters. Another case, you can see all this loose skin around the knee, around the thigh, the inner thigh, and we can see how well we managed to handle all the skin by the means of the so-called apex procedure, which is the extended thigh plasti with both a horizontal and a vertical scar. We can see in the three-quarter view the length of the scar, which is, of course, very important, but it is the only kind of procedure that allows us to reduce and to get rid of all this loose skin. This is another case of thigh plasti in which we restore a very normal situation, and the patient, of course, is really, really happy of this. This is another case of the kind of brachioplasty that we perform with the posteromedial scar. Usually, brachioplasty is conducted with a medial scar in the bicipital groove, but it's very, very, very visible when the person raises the arms, for example. The other technique is the posterior scar, but this scar is really visible when the patient has the legs down and the person is on his back. The posteromedial scar is done in a way that is very, very concealed. So it is really discreet, and the person don't have problem to go sleeveless. This is the back situation. As you can see, there's no visible scar. And this is another case. You can see all this sagging skin here that, of course, couldn't be retracted even with the use of Renubi-Onge plasma. But we perform a posteromedial brachioplasty, so all the skin, we get rid of all the skin, and a very normal situation was restored. And the patient is really happy of this. And I think this was my last slide. And with this, I'd like to thank you all for your attention.
You kept the audience in wow. We never had such a big audience watching a presentation.
Yeah, I'm really glad.
Congratulations.
Thank you.
It's amazing because somebody watching this video gets everything they need before they go ahead, which operation, who is the doctor, and whatever. And we have quite a few questions now from the floor. Allow me, because of age, the prerogative to start the first question. I am fascinated by skin tightening because this is the one part that other doctors told me not to go to them. Is there, how do you decide if a person is a candidate? I'm talking about the arms. My arms are very good, but I want to make them better. How do you decide?
It's a really, really good question. I thank you for it. We have to give the right indication. Of course, when we have a very small amount of fat, and I'm talking also for the aesthetic procedure, of course, we don't have the need to use the Renuvion J plasma, because if we take off very little fat, of course, the skin will retract itself, because skin has the quality of retraction also. So Renuvion J plasma don't have to be used with small things, small amount of liposuction, but perhaps this is not the case of lipidematous patients. The other scenario is when we take a lot of fat. This scenario also gives not very chance for Renuvion J plasma, because if we leak very much skin, of course, we cannot expect for the Renuvion to retract all this amount of skin. In the case I shared with you of thigh plasty, you saw in the pre-operative picture that the loose skin was very massive. Hanging skin was very, very big. So it is not reasonable to expect a retraction even with the J plasma. So J plasma has the best indication in between. So when we don't take too much, we don't need to take too small. So in between is a very good, the patients are really good candidates for J plasma. And the use of J plasma in this particular candidate can be the discriminant not to perform a body contouring procedure, or at least to perform more conservative procedures. So the answer to your question is that the person who get the most of the Renuvion J plasma is a medium person, in which we don't need to take off too much, and of course we don't take off too little, because we don't have to use J plasma when we take off too little.
Since we are on the Renuvion, we will take the first question from a French lady, and Nathalie Spenlet will translate, so that we finish with the Renuvion at this stage.
Hello, Dr. Agostino. Thank you very much for your presentation. I have a question from Constance. So you mentioned that the Renuvion technique shows its effect about 6 to 8 months post-surgery. Is it something that should be renewed in time?
Renuvion J plasma acts inducing a strong contraction of the connective tissue. So there is first off, there is an immediate result. Immediately after passing Renuvion J plasma, we can appreciate the tightening obtained of the skin, because the skin, if we perform a pinch test, is immediate tighter. But Renuvion J plasma also mediates the synthesis of new collagen. Of course, the production of new collagen is a thing that requires more time. So the best results are appreciate normally after 6 to 8 months after the procedure, even if an improvement can be seen immediately after the procedure. Many doctors back in the US talk about the wow effect, because we can immediate see the tightening of the skin if we perform a pinch test after passing the Renuvion J plasma. And these results are lasting, because when contraction is performed, it is performed. So there is no possibility for the connective tissue to get back loose. It remains contracted. So the results that we can obtain with this tool are permanent. Of course, there's the aging process, but of course it goes on. But the contraction we can obtain is very, very lasting.
Ladies, in order to gather the questions, I think we have more on the J plasma. So Patricia, Mia, and Natalie, find all the questions, please, and start asking them so we finish this topic.
Ok, I have buonasera, Dottor Bruno. Siamo rimaste tutte con la bocca aperta. It was great. Thank you so much. And Rania, she wants to know, is J plasma used in a subsequent procedure or same procedure as the liposuction?
Both of them. We normally we use J plasma at the end of liposuction. So we perform liposuction, both VASER lipo, parla, whatever. At the end of the procedure, we use Renuvion J plasma. But of course, we can use also after. Many times, the patient undergo another procedure, for example, the arms, and we use J plasma for treatment of the thighs. And we can also do another strategy. When we treat the thighs, we can use first time J plasma when we treat the thighs. But we can use again J plasma in a subsequent procedure when the patient, for example, do the arms. So we do the arms and we pass again J plasma both in the arms with the same handpiece and again in the legs, in the thighs. So we can also improve the results as we have subsequent procedures. So once the handpiece is open, we can use primarily to treat the area that was suctioned, but also to retreat an area that was already treated, and the effects is even better.
Okay, fantastic. Thank you so much.
Ladies?
Dr. Bruno, piacere. So a patient can have surgery, could have had surgery with another doctor, and after some time come to you for J plasma?
Yeah, of course. Even if the procedure was conducted from another surgeon, we can improve the results. We can perform Renuvion J plasma. So, of course, we can do secondary procedures.
Also, would a patient expect the same level of swelling after J plasma as with regular liposuction?
We don't have to, there are two different things. J plasma doesn't suction. J plasma only contracts the skin. So in this, at this stage, liposuction has already been performed. J plasma itself doesn't even cause swelling or edema because it's a very conservative procedure. Of course, the swelling is caused by the liposuction itself. So Renuvion J plasma itself doesn't cause any other or even longer swelling of the treated area.
Yeah, Mia, you can go ahead with the chat because at the group there's no more J plasma.
Okay. take other questions. It's fine. Continue to other questions.
Perfect.
Have you ever done breast reconstruction after mastectomy in conjunction with liposuction for lipoedema? So have you done the breast reconstruction, same surgery as the liposuction? And can you?
Well, I perform many surgeries altogether. Alessandra proposed a case of the so-called mummy makeover, which is a mammoplasty, an abdominoplasty, liposuction everywhere, the so-called Brazilian butt lift, etc. But perhaps it is not correct to perform in the same session a mastectomy and a reconstruction with the liposuction. We have to remember that lipedema liposuction are really heavy for the body. So it's also a mastectomy. So this particular combination probably is not the best one. I'll suggest to perform in two different moments.
What factor, other than the amount of fat removed, are relevant in regards to whether or not skin removal or lift would be needed?
The quality of the skin itself, which is in turn related, for example, to the age of the patient. Also, if a patient has undergone bariatric surgery unfortunately leaves the skin really poor in quality. So when we perform liposuction for lipedema in a person that underwent bariatric surgery, the skin is really in poor condition. So in this case, even Renuvion plasma perhaps cannot avoid a body contouring procedure. So other factors that we have to see are, of course, the age, because of course with the age the skin quality reduces. Also some intrinsic factors of the skin, and also the fact that the patient has some conditions such as diabetes, etc., which can give very poor skin retraction.
Thank you.
Okay, and Heidi would like to know how many liters can be removed using VASER per operation?
This is another $1 million question. Of course, we don't have a rigid protocol. We cannot say to everyone, I'll take you, let's say, 5,000 liters of fat. The Brazilian Society of Plastic Surgery suggests not to aspirate more than 7% of the weight of the patient in a surface nor bigger than 40%. So we have to stay safe as the first thing. We perform very massive liposuction. Valeria knows something about that, but we have to stay safe. So we do not aspirate more than 7% of the weight, but this is not the only thing that we have to consider. We have to consider hemoglobin, for example. We have to consider, let's say, the liver, the heart, the lungs, etc. So we have to consider the body as a whole. Considering all these things, we can decide how far we can go.
Perfect. Thank you so much.
Thank you.
Continue, Patricia.
Okay, I thought it was me as now. Deborah, she says, would like to know what type of anesthesia he uses and what his opinion of TIVA, T-I-V-A, is.
We only utilize general anesthesia, only. I think is the best one because general anesthesia can be seen as a very dangerous one for the patient. On the contrary, it is the safest, because only with the general anesthesia we can control everything. We can control the levels of the oxygen in the blood, we can control the heart, the lungs, etc. So it is the safest kind of anesthesia. We don't use twilight sedation because the procedure is very long. Medially, it's a 4 hours operation. So only with the twilight, it doesn't turn out to be good in our hands. All patients have a one-night hospital stay, so we can use general anesthesia because we don't have to discharge the patient the same day. We have to remember that sometimes twilight sedation is performed because the structure only can have a day surgery setting. So many structures don't have the possibility to have an overnight stay. So in this situation, they cannot use a general anesthesia. But all our patients stay for one night, even longer if they come from very far. So we use general anesthesia all the time.
Fantastic, thank you.
Doctor, how do you break up fibrotic tissue? How do you handle fibrotic tissue?
Fibrotic tissue is broken up with the pulse system because there are some specialized cannula called helix cannula that are especially designed for the fatty fibers of fat. Also the VASER, because the VASER probes, there are some probes that are designed for the fibrous tissue, which is specifically speaking the one groove probe, which is designed for the fibrous tissue. So we can handle fibrous tissue both with the VASER lipo and with the pulse system, because these tools have specialized cannulas or probes to address this kind of tissue.
Thank you.
Natalie?
We just want to be clear that in your surgeries, you do leave open the possibility to use all of these different tools on one patient, correct? So you do utilize all of these different tools routinely in your surgeries.
Absolutely, absolutely. For example, when I treat the upper limb, which is the arms and the forearms, I use everything, because in the forearms I use the wall for the deep planes, the pulse from the superficial planes. In the arms, I use the VASER lipo to treat the fat, and I use the PAL to take the fat out. And at the end of the procedure, I use Renuvion J plasma. So there are cables everywhere. Actually, but I think, as I demonstrated to you, there are pros and cons of everything. There is not a tool that has only pros. So to get the best result, we have to use the best of everything. And if we have the possibility of melt these tools, we can assure radicality of the procedure and, of course, a faster recovery for the patient. And also anesthetically pleased glimpse.
Thank you.
Dr. Bruno, when you do this operation, you use the wall and the PAL and the VASER the same day, the same time, or you don't separate operations? I mean, you use tumescent-assisted liposuction as well?
Tumescent liposuction is the base, because because both VASER lipo, PAL system are based on a tumescence status. So tumescence is created every time. After tumescence is created, we use the VASER lipo and then the PAL system. But the first step is, of course, to create tumescence. Tumescence is really important in the VASER lipo because the acoustic ultrasonic waves is selective for the water of the tumescence fluid. So we have to use quite a lot of tumescence fluid to give the best atraumatic procedure with the VASER lipo.
And what is the tumescent fluid? There is a certain number of liters you can use per operation. I mean, can you use 10 liters of tumescent liquid, or is 8 liters?
We can use very much because we use tumescence, but then when we perform liposuction, we suction away not only the fat, but also part of the tumescence itself. Another great advantage of using and performing the surgeries under general anesthesia is that we can utilize minimum doses of local anesthesia in the tumescence fluid. So there is no risk of general toxicity because local anesthetics has the great problems of general toxicity. So if we perform the surgeries under general anesthesia, we can get rid of too much local anesthesia. So we don't have the risk of reaching higher excessive doses of local anesthetics.
Thank you.
So this is another advantage of using general anesthesia.
Good. In order to advance, Patricia, can we take 2 questions from the group each time? So you take 2 questions so that we advance because we have a lot, and then 2 Mia and 2 Natalie.
Perfect, fantastic. We'll do that. Yasminka would like to know, can VASER tool dissolve lipomas, especially in arms?
VASER lipo is not intended for lipomas because if we evacuate the fat of the lipomas, we leave the shell of the lipoma itself, and it can turn back quite quickly. So the strategy for the treatment of lipomas is the excision of the lipomas. So VASER lipo doesn't have indication in the treatment of lipomas.
Perfect. And
nor
Melissa,
any,
oops, sorry, doctor.
Sorry, nor any type or liposuction, because lipomas have to be treated by excision, cannot be treated by liposuction, because liposuction, whether it's PAL, WAL, etc., only take the fat away but leaves the shell of the lipoma, and it can turn back quite soon.
Okay, and thank you again. And Melissa, she says, is brachioplasty always performed at the same time as liposuction?
What?
Brachioplasty.
Yes.
Oh, yeah. Brachioplasty, if the amount of fat is not that much excessive, we can perform it in the same session. If we have too much fat, it is safer to perform in a subsequent procedure. But if the amount of fat is not that big, we can do in the same time. In some photos I show to you, the lady had considerable fat, but we managed to perform brachioplasty at the same time.
Fantastic, thank you.
Thank you.
My question is in Italian, and then we'll answer in Italian and also English, so we'll both translate it. Lei pensa che il lipoedema possa essere sulla schiena e sullo stomaco? She's asking if lipedema can show up on the back and in the stomach region.
Shall I answer in Italian or in English?
In English.
In English, please.
In English. Lipedema can be everywhere except for the dorsum of the hand and the dorsum of the feet. With different percentage, it can be everywhere. It can be in the neck, it can be on the belly, it can be on the dorsum, etc. There is a picture by Karen Herbst where there is the body with the various percentage of the frequency of lipedema in other sites other than the lower and upper limbs. So lipedema can be everywhere, even in the scalp. Of course, course, it is quite rare in these sites, but it can be also everywhere except for the dorsum of the hand and the dorsum of the feet, because normally there is not fat in these sites. But apart from that, it can be everywhere, unfortunately, with lower rate, of course.
Dr. Bruno, because Italian is a fast language, if you can say a few words to the lady in Italian, then because then we have to translate later. So if you
Okay.
can.
Ok, allora ritorno per un momento nella madrelingua per dire che purtroppo il lipedema può interessare qualunque parte del corpo, eccezion fatta che per il dorso delle mani e il dorso del piede, ma qualunque parte del corpo purtroppo può essere interessata. C'è una figura molto carina proposta da Karen Herbst in cui c'è il disegno della figura umana con le varie percentuali di interessamento di lipedema nelle varie aree corporee. Quindi il lipedema può interessare addirittura finanche il cuoio capelluto. Naturalmente queste sono delle localizzazioni inusuali, meno frequenti, però purtroppo il lipedema può interessare anche queste zone, purtroppo. Quindi non solo il lipedema non riguarda solo arti inferiori ed arti superiori, anche se sono le sedi più frequentemente interessate, ma molto comunemente c'è l'interessamento del dorso, esatto, l'interessamento del dorso, della regione scapolare, eccetera. Quindi purtroppo può essere presente ovunque. Sì, mi riferivo a questa figura.
Grazie, Alessandra.
Thank you. The next question is, do you operate full legs, front and back in one operation?
It depends on the amount of fat present because we cannot go over that famous 7% of fat to withdraw. Normally we perform back and the front at the same time of the lower legs and the back and the front of the thighs at the same time. Especially the legs is performed in the same session. The thighs, sometimes, if there are too much fat, are divided into sessions. In one session, we usually treat the anteromedial aspect, and in the other session, we treat the posterolateral aspect of the thighs.
Thank you.
Ladies, it seems that Natalie has a problem with connection, so Patricia and Mia, you will share the questions and I will give you a hand.
Okay.
Patricia?
Yeah, Margaret, she says, does Dr. Bruno operate privately on non-Italian patients?
Yeah, of course, I operate also non-Italian patients, of course.
Great. And Yasminka, a question for Dr. Bruno. Which method or combination of methods will you use with a patient who previously had 2 or 3 liposuctions on her forearms and arms, but still has irregularities and lipomas left? So there's a lot of scar tissue underneath.
Yeah, this is a very, very good question. When we treat when we perform secondary procedures, of course, we have to manage the scar tissue left behind, which is quite normal that happens. We use the VASER lipo with the spatial probes designed for the fibrous tissue, and we use the PAL system with the basket cannula to even the surface of the skin, because these spatial cannulas, which are called basket because of the form of the shape, or flared cannula, are able to perform the so-called equalization of the remaining fat. So we leave a smooth surface on the skin because we leave an even layer of normal subcutaneous fat. But we usually pre-treat the fat with spatial probes of the VASER lipo designed for the fibrous tissue.
My question is from a patient that would be traveling to see you. Does the distance traveled affect how much lipo can be done, or how long a patient must stay before traveling back home?
Well, traveling from abroad, of course, the patient has to stay in Italy, in Rome, for some days. He cannot goes back home the day after, of course. So I can advise to stay in Rome for about 7 to 10 days before coming back home. Especially if it's a very long distance flight. But the person has to consider a 7 to 10 days stay.
And doctor, most patients would need more than one surgery, I would assume. How long do you space those surgeries out?
Normally, something from 3 to 4, 5 months, because shorter period of time, in my opinion, is too much, because these liposuctions are really heavy if we perform a good liposuction. Of course, if we take just 1 liter off, we can perform another procedure also after 10 days. But if we, because we do very massive liposuctions, I let 3 to 4 months to pass before submitting the person to another procedure, because we have to restore hemoglobin, the iron deposits, etc. So, in my opinion, this is the best period to perform and to manage the different sessions of liposuction.
Thank you. Patricia?
Yes, Mary wants to know, do you know what types of tools you will use upon examination of a patient, or do you decide when you are in the operation?
No, let's say that the decision is based on the body size. So if the patient has to treat the lower legs, we know that we treat it normally with the wall liposuction in the deep planes and with the pal liposuction in the superficial ones. So the decision is made not in the intraoperative period, but is done on this, depending on the body area that has to be treated.
Right. And my next question from D is Dr. Bruno's waiting list very long?
Unfortunately, kind of, because we stay closed for almost 2 months because of the COVID situation. So the situation is now 2 months longer because we had to perform the procedures that were canceled because of the situation. Let's say that we have a list of about almost a year.
Perfect, thank you.
When we plan some operations, we schedule all the procedures. So the person, of course, once the person starts, is scheduled for all the procedure he has to do, of course.
Fantastic, thank you.
Thank you.
My question is consultations. Will you do them for foreign patients via Skype or telephone?
Well, this is a debated question. I personally don't like the Skype consultation because it is not it cannot be a medical consultation. So just to have a glimpse and to judge a little the situation, I let the patient send me photos, videos, etc. So I'll give an idea of the situation. But nor these photos or videos can replace a medical consultation. So the patient can send me the photos, of course, and I'll give a personal judgment, but that doesn't replace a medical examination, because the examination is done not only with the eye, but also touching and having pinch test, etc., having the possibility to touch the quality of the fat, whether it is a more edematous one or it is more fibrous one. Of course, this cannot be judged only with photos or even by the means of, I don't know, FaceTime, etc., Skype, etc. So I give a personal judgment only with the photos, but that doesn't replace the visit itself.
Thank you. The next question, at the time of a thigh plasty, do you do any small amount of liposuction to finish off any area that needs any kind of touch-up?
Yes, of course. We use the thigh plasty or the brachioplasty, etc., to do little touch-ups here and there, just to give the best results. So when the patient undergoes another procedure, we try to get the best out of it, and we use that time to do touch-ups here and there, to leave everything smooth, to give an aesthetically pleasing result.
Thank you. Patricia?
Yes, Mary would like to know, what is the youngest age you will treat for lipedema?
Well, let's say 17, 18 years of age. Younger perhaps is too much. Let's say that the best age is perhaps 17, 18, after the end of puberty, because with puberty, lipedema insets and worsens. So we have to have a definitive photo of the situation. So let's say something between 17 and 18 years of age.
I will take a question, Dr. Bruno, from Kate Foster. Do you think that different methods have different amounts of time that the results will last? We had some women here who had VASER, who then said that their treated areas grew large again within a year. How does that compare to your experience of using, say, VASER vice wall?
This is a good question. Of course, VASER doesn't work for itself. Of course, you can also have a Ferrari in your garage, but if you cannot drive, the Ferrari doesn't drive by itself. So the VASER lipo, it's almost the same. It is not sufficient, it is not enough to have the VASER. You have to use it well. So if the procedure is done well, the results are really good. The recovery is really fast, faster than the traditional liposuction, also the wall liposuction. And there are long-lasting results.
Yeah. Patricia, you can continue. Thank you.
Yes, thank you, Maria. Kim would like to know, do you perform skin tightening on lower legs and forearms too?
Normally not, because unless there is a very, very massive liposuction that will leave loose skin, normally lower legs and the forearms have fewer fat deposits. The skin normally is of better quality compared with the inner thigh, for instance. So normally there is no need to use the Renuvion J plasma in these body sites, because the skin normally in these sites is really strong, so it contracts by itself. And normally the fat deposits are not really, really, really massive. So normally not.
Right, thank you. Is it Mia's or Maria's or myself?
Yourself.
This is a question from Cascio. Can you perform liposuction on a well-controlled diabetic patient that uses metformin for lipedema?
Yes, of course. If the diabetes is well controlled and the patient is under medications such as metformin or even insulin, there's no problem. Perhaps we will have a more conservative liposuction. So probably we will schedule one more operation, but this is not an absolute contraindication of the operation itself.
Thank you. And a question from Natalie. Pensi che, we'll do it English Italian, pensi che il lipodema possa crescere dopo una prima operazione in un altro posto? Do you think that once lipedema is removed in one spot, it can start growing in another area?
Yes, unfortunately, this is a kind of behavior that is typical of lipedema. When we start treating, let's say, the lower legs, we have seen the worsening of the lipedema in the thighs, or even the worsening of in the arms, or even the beginning of the lipedema in a not clinically affected area. So one important thing that I'd like to stress out is that when a patient decides to undergo liposuction, it has to embrace this kind of pathways, because it's important that the patient could finish all the surgeries scheduled and to him, because if we treat only one body site, let's say the lower legs, lipedema could worsen in thighs, for example, or even in other sites not clinically affected at the time of the diagnosis.
Thank you. Patrizia?
Sure, and Irina, she says she's been following you on Facebook and she has many answers already from those videos, but you refer to cosmetics procedures. So she wants to know what's the difference, the way liposuction is carried out for lipedema and the way it's done cosmetically.
It's really another world, because first off, the goals of these liposuctions are very different, because the main goal of liposuction for lipedema is to take as much of this ill fat as possible. So it is a massive liposuction, a liposuction that aesthetically speaking could even worsen the situation, because it can leave loose skin, it can leave sagging buttocks, for example, that need to be corrected with subsequent procedures. Aesthetically speaking, a liposuction performed for aesthetic regions is a liposuction not intended to weight loss, of course. It is a liposuction intended to treat a small amount of fat that are non-responsive to diet, exercise in critical areas such as the flanks, the abdomen, the hips, the inner thighs that are typical to many, many women. But the goals of the surgery is really different. So a person affected by liposuction is a person that has to be cured of this illness. So we have to take as much of this ill fat as possible. So the situation is really different. And in my practice, I don't use the wall system in the aesthetic procedures. I only use the wall body jet for the lower legs and for arms in the aesthetic, in the lipidematous patients. I don't use it in the aesthetic field. In the aesthetic field, I use the VASER, I use the PAL, I use, of course, Renuvion J plasma, but I don't use the wall system.
Great, thank you so much. And Katrina, she says, what benefits do you see to the thigh lift approach rather than a lateral lift?
These are procedures intended to treat different body sides, because an inner thigh plasti only treats the inner aspect of the thigh. It doesn't treat the lateral aspect of the thigh. The lateral aspect of the thighs is better addressed with other procedures, such as the body lifts, such as the buttocks lifts, the belt lipectomy. So the inner thigh plasti only corrects the inner aspect of the thigh, but doesn't correct the lateral aspect.
Perfect, thank you. Mia, it's your turn now, I think.
Yes, I'm going to do a question from Maria Anna. Lei ha avuto 3 liposuzioni e nessuno dei medici mi aveva parlato del lipodema. 24 mesi fa ho fatto un body tight e il grasso è ritornato 4 volte di più. Ritornerebbe anche con questa tecnica. She's had surgeries, liposuctions, body tight. The fat has returned. It was never diagnosed as lipoedema. If she goes to you, will the fat return?
Yeah, indeed, this is a very common situation. The situation in which the patient has performed aesthetic liposuction elsewhere, and then in some way, the diagnosis of lipedema was done. In this situation, the patient can perform, of course, lipedema liposuction with all the technologies we use, etc. So we can perform lipedema liposuction even if the patient has undergone normal aesthetic liposuction.
Mm-hmm. And another question, jumping over to compression. After surgery, how long must one wear compression? And what kind of compression do you recommend?
Immediately after the surgery, the patient wears a compression garment, a post-surgical compression garment. Immediately after the surgery, which means after 3-4 hours, we start the conservative treatment. Our physiotherapist comes in the hospital to treat the patient, and then he comes back the day after to treat the patient, and mainly in the lower legs to perform bandages. So for 10 to 15 days, the patient is treated with bandages. So apart from the bandages, the patient doesn't have anything. After the bandages, the patient can turn back to use post-surgical compression therapy.
Patrizia?
Of course.
Yes.
Sorry. After the edema is gone away, after the volume is decreased, the patient is advised to turn back to a flat knitted hose, of course, but not right after the surgery, because the leg is much bigger because of the swelling, and it requires some months before we reach the final volume. So the patient can utilize again a flat knitted, customized hose.
Real quick, what is the oldest age you will work on?
The age itself is not a contraindication. We have to see the health status of the patient. Let's say that up to 65, if the patient doesn't have medical issues, there's no problem. And even if the patient is older, we can do smaller and more conservative procedures. So we can schedule some more procedures, each of these more conservative. So the recovery will be faster, and we can treat with this little trick even older patients.
Thank you.
Great. And Maria wants to know, some doctors prefer to split the surgery in two if the patient has lipedema in upper and lower legs. Can you perform one surgery for the whole legs if the patient is not overweight? You mentioned that the recommendation is 7% of the body weight. Can it be exceeded with 1 or 2 liters? And which operation do you recommend if the patient has a normal weight and the patient also has restless legs syndrome? Is that okay to do surgery?
Okay.
It's a long question.
This is a, a very, very long question. Let's say that one operation perhaps can be done only in a first stage when we don't have too much fat. But when the patient is at the second stage, it's really, really rare to perform only one operation. We can perform the operation in the all lower limb and then repeat the entire lower limb after 6 to 8 months. But the strategy perhaps is to perform subsequent liposuction, so to treat the lower legs and then the thighs. One operation may be suitable only for first stage, not, of course, overweight patients. The surgery can be performed in the restless syndrome also.
Perfect, thank you. And Susan, she wants to know, after liposuction on the tummy, can you do a tummy tuck straight away or do you like to wait? Thank you.
Yeah, this is a very great question. And this is our strategy also. As I perform many tummy tucks, it's one of my most commonly performed operation. I do the tummy tuck at the same time. So I perform the so-called lipoabdominoplasty, which is the most advantageous treatment for many reasons. Because, of course, we get rid of liposuction because we take all the fat below the umbilicus off. And of course, we have a better aesthetic result because lipoabdominoplasty, if well performed, is able to give very, very good. So I routinely perform lipoabdominoplasty. So rarely I do a liposuction and then in another operation, the tummy tuck.
Perfect, thank you. Mia?
This question is from Shira, and her question, we've touched on this. For foreign patients, you prefer seeing them in person. So that would either mean that they come visit you, they have a full consultation in person, they set up their date a year down the road and come back for surgery. Would it also be possible for these patients to have a consultation over Skype, over the phone, over email, set up an appointment to have the full consultation in person, and then get them into surgery within that week if they already hold that spot a year before, if that makes sense?
Well, as I said before, I let the patient send me photos, videos, etc. But they cannot replace a physical consultation. So judging from the photos, I'll say to the patient, thanks for contacting me. Judging from the photos, it seems to me that you may have a second-degree lipedema. Probably you will need 3 procedures, 1 in the lower legs and 2 in the thighs. But it's something that is probably, it's not sure, because it's only a picture I see, it's only a video I see. I need to evaluate the quality of the skin, I need to evaluate the quality of the fat, whether it is edematous or fibrous. So a physical consultation is needed and required. Because of the list of patients, it is not feasible to do the consultation and then to perform surgery the week after, because we have many patients scheduled. So it will not be free to perform liposuction the week after the consultation. So unfortunately, the patient has to come twice, once for the consultation and then some month after, because we have a list of some months, come back for the procedure itself.
How many patients do you see for consultation per day for lipoedema?
Well, it depends. I do visits only 2 days a week, because the other days I'm on the operative theater, so I cannot do that. Well, per day, certainly 2 or more, 2 or 3 for sure.
Yes, I know, yeah. So there is no, if I say, Dr. Bruno, I show you the pictures, you tell me I have stage 2, I need 3 surgeries, a year in advance, I come on the 20th of the month, you book me for consultation, and on the 21st to put me for operation. Can you do this?
Well,
that's what the question was, I think. If she can have the, sorry, if she can have the photos and idea, and then she's 100% sure that she's coming to have a surgery, but you want to see her before. So the day before to have a consultation 1-2 hours, and then the following day to have booked her a year in advance for both consultation and operation.
Oh, I get it. So let's say today the patient sent me the photos, so I'll see a year later, the day before the scheduled first procedure.
Yes.
Yes.
Okay. Yeah, this is feasible, but of course I do want to have the time to talk with the patient, to judge her, to touch the deposits of fat, etc. Of course, with the photos and videos, I get an idea, and I can suggest to the patient the kind of protocol that we should perform. But of course, a visit is really important. So perhaps the patient can book the operation for the year ahead, but we have to see some days before for just to have, just to shake hands, to know who I am going to operate on.
Yes, yes. So you can help. If it's for a man overseas and she books a year in advance, I'm sure she can come on Monday and she can have an operation on Wednesday.
Yeah, of course, yes. Of course. And on Tuesday, the patient can have a glimpse of Rome, because
maybe we allowed the doctor to have some water. How many questions we have? Do we have a lot?
Yeah, we have from the group, we have like 3 more left, something like this.
I'd like to get the next one in. I have Elisa from the Italian group writing, Dr. Bruno, what are the chances of partial or full comeback of the lipoedema or an increase of it in other areas once operated? We touched on once operated, but what are the chances of lipoedema returning? I say you do full legs. What are the chances of it returning to my legs?
Well, there is not a specific chance, but it's a great chance, because it depends also on the age of the person. Let's say that this person is 20, for example, then she gets pregnant, then she had another baby, then she has menopause. All these situations are really at risk of putting her with turning back of lipedema. the situation is different if for example, the woman doesn't want to have any more pregnancies. So we can expect the lipedema to come back or to worsen with the menopause, or if the woman is on hormone replace therapy. So the answer to this question depends also on the age in which liposuction is performed. Situations with the hormonal changes, such as pregnancies, etc., put the patient on higher risk of recurrence of lipedema.
Thank you. Patricia?
Yes. Marianne says, what about around the knees and fat pad below knees? Does that leave extra skin after?
Usually the knee responds really well to liposuction because it's a really tough skin. The very biggest problem is with the inner thigh and with the arms, whose skin is by itself really loose. But the inner knee is really tough. So normally there's no need. We cannot expect so much thing there.
Okay, and the last one from Maria. She says, how long does one need to wear the compression after the bandages?
At least 1 month. But of course, the flat knit, the hose should be worn also indefinitely. So let's say that the post-operative hose has to be worn for about a month, after which the leg is turned to a restored volume and the patient can turn on the flat knitted hose.
Perfect. Thank you. Mia, do you have more questions?
I do. What is your experience with lymphedema and liposuction?
Well, liposuction can also be in some ways performed also in lymphedema patient. Personally, I do not treat lymphedema person, so I don't have experience on that. Normally in Italy, and it's also kind of a trend of Italian plastic surgery, tend to treat lymphedema with other types of procedures, such as microsurgery, etc. I know that in other places, lymphedema is also treated by liposuction. But in Italy, let's say that the school of Italian plastic surgery prefers to treat lymphedema with microsurgery.
Thank you. I think my questions are completed.
And you, Patricia?
I have 1.5.
Yeah,
so
because I think 2 hours a doctor, and we have Valeria who wants to say a quick hello to all of us.
So Yasminka, she wants to know, which tools do you use when doing a tummy lipo?
Well, for the tummy, I use the VASER and the PAL, which is really spectacular in this in this body size. VASER lipo is used very well in the trunk as well as in the tummy. So a lipoabdominoplasty is performed by VASER lipo and the PAL system.
Great. And the last one, Lisa, it was sort of answered before, but she says, since some techniques are more expensive than others and you make the decision during the surgery, is the cost you give someone before the procedure just an estimate?
The decision of the tools I use is done not intraoperatively, but before. Judging on the site we have to treat. Technologies such as the wall liposuction and the Renuvion J plasma has some extra cost related to the disposable hand pieces used. But of course, the patient knows it because the patient knows that for treating the lower legs, we use the wall technique. So there is an extra cost because of the disposable kit of the wall technique. The same thing for the Renuvion J plasma, because we use it on the inner thigh or on the arms, and there are extra costs related to this.
And before we close, I don't know if this was asked, doctor, do you normally start with lowers if you are doing multiple surgeries on legs?
Normally, yes. I normally start with the lower legs, then the thighs, then the upper limbs. I do this in the, let's say, 90% of cases. Of course, they may be patients that have particular situations. For example, pain, really big pain in some areas. So we can give the priority to this and treat the side that is really painful for the patient, and then do the other ones. But normally I prefer to start with the lower legs, and let's do then the inner, the thighs, and then the upper legs, the upper limbs.
Thank you very much. I think that Valeria is back, and she wants to say, she never left us. She's back, and she wants to say a few words to the group as well. So 2-3 minutes, doctor, and then we will let you go because you need to catch up for tomorrow. Valeria? Valeria is the chair of the Italian Association, and she had the operation last week with Dr. Bruno.
Yes, thank you, Maria. Thank you, Dr. Bruno, for this event. And for me, it is important to stay here with you because 4 days ago, Dr. Bruno performed my second Lipoedema surgery on me. And he took out the biggest amount ever for Lipoedema surgery, because he took out 13 liters of Lipoedema fat from me. I am a severe Lipoedema stage. I am a stage 3, formerly obese and still obese, and I am a very complicated patient, denied from a lot of super experts, keeps, and I see that in all this webinar, I believe that all the surgical expertise of Dr. Bruno came out, but what I wanted to share with you is the humanity, and he is so dedicated to his patients, not only with patients, with very severe patients with mobility issues like me, because 4 days ago, he put me to sleep just saying, dream the day you will walk again. And I really want to share this dream with you and also with Dr. Bruno, because it is so important to me to have my life in the hands of such a person that is so human and so dedicated to all the patients, not only to Lipoedema patients, also to obese patients, to all his patients. He is so dedicated and human, and so he's a very nice person, apart from the surgical skills we've been discussing about in the last 2 hours. And so I really want to share with you his humanity, apart from the miracles he played, for example, on my arms. You can see my pictures in the global group, in the Italian group, and so you can see my surgical results. After I'm here, after 13 liters removed, I'm just recovering. Pain is big, but I'm here. I'm moving my legs. I'm wearing my compression garments and taking painkillers, and I'm so thankful and grateful to Maria for everything she does for us, and for the surgical awareness of lipedema, and to, of course, to Dr. Bruno, because the LIO Association, the Italian Association for Lipedema Patients, will be grateful to Dr. Bruno every time, because Dr. Bruno is the one that calls you on Saturdays at 10 o'clock in the evening to say, oh, I have a new paper about lipedema, I'm reading it, it's fantastic. So it's so rare to find a doctor who is so devoted to lipedema cause and to help us in every situation, and in helping also us with prizes, with free consultations. He did everything to help Italian patients to fight lipedema, and he's doing a lot. So thank you, Dr. Bruno, for all you are to us. We
wish you a speedy recovery, a pain-free. I will ask Alessandra if she wants to say a few words before I take the floor to close this meeting, and thank Dr. Bruno.
Yeah, thank you, Maria, and thank you, Valeria, for this occasion. And I think that it's been an amazing occasion for us, for LIO, to co-host this event. We thank so much Dr. Bruno for his knowledge, for sharing his knowledge with us. And I think maybe it was among all the surgeons, it was very meticulous in his presentation, and he let us understand a wealth of knowledge about lipedema surgery. The other thing I wanted to ask to all the audience is that I noticed that we are receiving many requests of joining the Facebook group. And as I said before, the Facebook group is dedicated to patients with a diagnosis, and you have to respond to the questions before you are allowed to join. And it is the same thing for the professionals. So if you are a professional and you want to join the Lipedema, the Facebook group of LIO, the dedicated professionals, you have to answer the questions to join in, and that's it. Please do that, and I thank you again, Maria, for this. We have this amazing occasion for the Lipedema Awareness Month, and of course, thank you for all your dedication and energy that you put into this big project.
Thank you. Well, on behalf of the global group, on behalf of the participants, both in the group and here, and the Lipoedema community at large, because this video will be watched several times, we would like to sincerely and warmly thank Dr. Bruno for his generous time, his outstanding knowledge, detailed knowledge and analysis of lipoedema treatment, which give us hopes, because many of us, once diagnosed with a lipoedema, always you will have lipoedema. This is a disease that will never leave us. It's a treatment, it's not a cure. We have many more questions, but maybe in autumn we could organize one more session with Dr. Bruno. And we wish you all the best in your research, in your scientific, in your medical profession. I'm sure I will personally see you, because I hope my sister is not listening. She will hit her head on the wall if I go for another operation. So I want to see these arms, because the doctors, they say they are good, but I want it better. So Dr. Bruno, from us all here, thank you. Ladies, can you unmute to give an applause to Dr. Bruno?
Thank you very much. Thank you.
Thank you.
It was a pleasure for me to be here, and feel free to contact me on the social media, etc. If you have any other questions, curiosities, etc., I'll respond in person. So feel free to contact me.
Thank you, Dr. Bruno. Because after each meeting we stay and we exchange and share information. But I think after today, we are all going to write a PhD. Buonasera, buonanotte, Dr. Bruno, da Londra.
Buonasera a tutti.
And see you.
Grazie tante, Dottor Bruno.
Yeah.
Grazie a voi.
Grazie per tutto.
Grazie.
Grazie. Thank you, Dr. Bruno. Bye.
Grazie a voi, arrivederci.
Bye.
Arrivederci.
Bye.